Welcome back, everyone. For the Rooted in Health session, we will hear from two organizations, the Harris Center and Rupani Foundation. Up first, we have Kail Graham from the Harris Center. Kail is the ABA SKIP program manager and a board-certified behavior analyst with over 20 years of experience in the field. He earned his master's in psychology from the University of Houston Clear Lake and has been with the Harris Center since 2009, contributing to both clinic-based and community behavior supports. Kail returned to the ABA SKIP program in August of last year. Please give him a warm welcome. Okay, test it out.
Okay. Thank you for that great introduction. It makes me sound a lot more impressive than I feel like I am. Let's see, where are we? Okay, great. So today, when I was asked to talk, and the subject is basically community health, I asked myself, like, what is the biggest impact that we do in the community as a in-clinic ABA program? And that is our home visits and our in-home training that we do with both our clients and their parents. So a little bit about me, that I've been a BCBA for 17 years, had 20 years of clinic experience, give or take. I worked in-home for 7 years, and the rest of that was in-clinic, or a combination of in-clinic and in-home work. ABA SKIP is a part of the RISE program with the Harris Center, and an ARPA-funded project. So what is ABA SKIP? ABA SKIP is a clinic-based ABA program, applied behavior analysis, that works one-on-one with children with autism or other developmental disabilities. We primarily start off in the clinic, and then we also do in-home therapy as well. We have a dedicated set of service coordinators that you can see over at the table to my right, your left, and they help guide families to get more services beyond what we provide. Our services consist of a 90-day program working on getting maladaptive behaviors under control, teaching skills that are difficult for our learners and they're not picking up in other locations. Requirements for our program: one, they must reside in Harris County. They must be between 3 and 8 years old and have an autism diagnosis. We are funded from the Harris County DEO, and we are very thankful for that, so that we can continue providing services for families that otherwise would not be able to access ABA services. So a question I hear a lot from parents, especially when we get those 3 or 4-year-olds that have just recently been diagnosed, is I was told I needed an ABA program, applied behavior analysis. I was told it would be beneficial for my child. Why? A lot of times when they're diagnosed, they're saying, here, you have an autism diagnosis, good luck. When they come to me and they're told ABA would be helpful, I have to describe what ABA is. And it's basically a scientific approach to using learning theories to increase skills, decrease maladaptive behaviors, behaviors you don't want to see, and doing it in a socially valid way, something that actually helps them. So a lot of the skills we work on, number one for 90% is communication, increasing communication skills. A lot of the maladaptive problem behaviors that we see is because the child is unable to communicate their wants and needs effectively. So we spend a lot of time working on requesting what I want appropriately. A lot of times their functional communication, functional, in that it gets them what they want, is screaming, aggression, things like that. So in order for us to work on reducing those behaviors, we work on increasing the skills so that they can get what they want more easily. And it's not just the parents saying, oh, I understand what he wants, but when they go to school, they have no clue. And so they get behaviors in the community as well. So parents ask, should I choose an in-clinic-based therapy or in-home-based therapy? It depends. It depends on a lot of factors. Where the behaviors are occurring, what the behavior is. Is the behavior dangerous to the child or to others? And what support is available? If I were to suggest a clinic-based program would be more effective for this particular individual, but there is not anything available, but they can access in-home services, go with those in-home services until something else opens up, and vice versa. So the four main areas where ABA therapy can occur is where the behavior happens. The easiest place from a therapist's point of view, is in the clinic. We have control over the environments, how we react to behaviors. We have control over stimuli, what they're wanting to work for, things like that. School, a lot of times we get parents that come in and say, they're fine at home. At school, it's another story. While we specifically tend to let the school districts and the teachers have their own behavior plan and everything, we also will reach out at the request of the parents and provide information on how we're doing what we're doing so that they can continue on in the school. Home, a lot of what we see happens in the home. This is where most of the behaviors naturally occur because that's where the kids in the age range we're talking about spend most of their time. And also with their parents that are pushing them to do certain things. The home can be chaotic, lots of different distractions, things like that. From a therapist's point of view, it's a little bit harder to implement a program in the home because we don't have control of every aspect of the situation. And the next one is the community, which in my personal opinion is the hardest place to implement a plan. You can't account for many of the variables. You can work on your plan, but there's also the social pressure for parents to conform to what in their mind should be happening in a certain situation. At the grocery store, sometimes I'll be there myself shopping, and I'll see a child screaming on the floor because they want something in that checkout aisle where they keep the candy and the little toys. I think they definitely do that on purpose, just to mess with us. But the kids can use that social pressure to get the parents to give in and get what they want. When I see the parents saying, nope, you can cry all you want, but it's not the right time for you to have this, I want to go shake their hand, which would be completely weird. But being a behavior analyst, I'm all about reinforcement, and so that's my initial feeling is I want to make sure that they know that we're not all judging them harshly. Okay, so pros and cons of clinic-based treatment. I pretty much just stuck to the two areas where most of our efforts go, in clinic and home-based therapies. So pros of the clinic, it's structure. We can control everything, their schedule. We have the resources to be one-on-one, so we can make sure that that schedule is followed. And then when they get used to that schedule, we can tweak it in certain ways so they get used to being flexible. A lot of our kids, once they get used to a routine and structure, have a hard time breaking out of that into a more natural flow. So we have to work that in. Access to specialized equipment and training, that sounds fancy, but it could be like mats on the floor, mats on the wall to keep things safe while we're working on things that they might not actually have access to at home. A lot of our stimuli it's not easy to transfer to the home either. Also, the ability to conduct safe functional analysis. So for those in the know, I can see you nodding your heads, but a functional analysis is basically a scientific way to present different conditions and determine the function of the behavior, which is basically why that behavior happens, how it's being maintained, and it includes us not necessarily intervening when behaviors happen so that we can see how they happen naturally. And we want to make sure things are safe. There's not always that environment at home in a contained space. And then one of the big ones that we've seen is the opportunity for social interaction with peers. And we've been seeing that more and more lately. So there we go. I was wondering where it was. Oop. Okay, so interactions with peers, so they can see appropriate ways of responding to the same situations. And we'll definitely use that and some group contingencies. Yesterday, in fact, I was in the classroom working with the kids, and one of them did something the way we wanted to, and the other one was not. And so we made a big show of providing social praise for the child that was doing it, and the other one went, oh, that's how that works. Cons, I'm going to go ahead and say this now, is opportunities for social interactions with peers. We've also had moments where they saw some behaviors we didn't want to share. That happens too. On the plus side of being in the clinic, though, we can respond appropriately when those behaviors happen, when they've seen them from other kids. And since it's not an established behavior, it's usually pretty quickly reduced. So it doesn't get become a long-term problem. Some of the actual cons for clinic program can be stimulation or sensory overload. It can get loud sometimes. Just yesterday, we had to walk one of the kids. We had to go for a walk because one of the other ones was having an issue, and he got pretty loud. And we're working on responding appropriately to different things with the other one. So we prompted him to ask for a break, to go for a walk, to get out of that environment, which is an appropriate way to respond to that. Some of the other cons for the families, cost of time and travel. Not all of the families have the ability to find transportation. And it's a more contrived environment. It's not a natural environment necessarily, like the home is. So pros and cons of the in-home: more familiar and comfortable environments, greater opportunity for family involvement. I actually saw this last week. We had a dad. So a lot of times there's like one primary caregiver with the population we work with. And for this one, it was the mom. She's the only one I had met to this point. She came in and told me the story after they did the first in-home visits. He was like teary because he actually got to see how the therapy was going and how much more verbal his son was at 3 years old after a few in-home sessions. With in-home, there's also some flexibility, and it's a more natural environment. So the cons are exactly what you'd think. It's less opportunities to work on social skills. You don't have all the equipment and the safety procedures, and you don't have other therapists around to like switch in and out of to trade off with if you need to. So factors when choosing is their specific needs and preferences. Where will they improve the most? The family dynamics and the situation. I don't know about you, but if I had to come up with a space to do some therapy with my 3-year-old at home, like tomorrow, like I'd have to leave right now and go start preparing a space. Not all the families have that, and so that can be an issue. So what we're doing at ABA Skip is kind of combining the methods. We want our cake and be able to eat it too. So we're starting in clinic, so we get all those pros. And then once the children get to a certain level, we don't have to get all the problem behaviors under control completely, but we're on that path. Then we can transition to home, where the behaviors are going to be occurring naturally, so they can work on it in the natural environment. So we can generalize specifically to the home first, and then start incorporating the parents into the interventions more and more. So we get those behaviors pretty much under control at home, or in the clinic, transfer at home, and then go from there. Just what I said. The pros and cons to that, once we move to in-home, obviously we don't have the ability to do the social skills and stuff like that, but we're able to incorporate the parents more and more and transition it to a more natural state where it can be maintained across, into the future. This includes helping us with the parent training so that we can have them involved right from the start. And definitely need to incorporate some like common sense basically into it. Not everything is going to be tailor-made. It's not all 100% this way or this way. And yeah, speak to the professional that's involved with your learner and see what's available and what they can do. Do we have any time for questions? We do?
We do have time for questions, 5 minutes.
Any questions?
Come on. Yes, ma'am, in the back. We have one.
Can you raise your hand so I can come to you? No?
Sorry, 25 minutes is a lot faster than it sounds like.
Thank you for your presentation. Love our VCBAs. So as far as I deal with families who kids have disabilities and a lot of them are on Medicaid, there's such a shortage of providers that are taking Medicaid. So again, our families are hearing the word wait list. And I was wondering, as the ABA Association, how you're working so that more people were taking Medicaid so that our families can be served.
That's a great question. Medicaid for Texas has been providing payment for ABA services for a few years now. We're still trying to work on getting the reimbursement rates up because a lot of private places don't want to accept Medicaid because it doesn't cover their expenses. There are some that definitely do. We've actually transitioned 2 of our kids recently that found a clinic that I think they were going to get 25 hours a week. Don't quote me on that. About 25 hours a week of ABA through with their Medicaid, which was fantastic. And we're happy to see our kids transition from us with limited service to something that can provide them a more comprehensive service.
No, I agree with you, and I think that if everyone would chip in just a little bit, it would take the pressure off of agencies like yours.
Yeah, what we are doing, we're 90-day program. It's
Right.
30 days, 3 months. And it's a quick, let's get you started on the path. We do see a lot of improvements a lot of the times, but we would like to see more. And that's one of the reasons we have our service coordinators with our team is to also like help them find other services and link to those.
Thank you.
And with the 90 days being so short, we can see a lot more than if we were like an ongoing until your problems are solved type of clinic.
Any more questions? I'm trying to find everyone in the room.
Yes,
Coming.
one.
Hi, thank you. My name is Chevis Worthy. I'm the children's counselor for Bay Area Turning Point. And I just wanted to know, is there a different approach to therapy with a child who has autism who's also secondary to domestic violence?
Ooh, that is a great question. That is an involved question. So we do work with kids that have like other issues, like we've worked with kids that have autism with Down syndrome, kids with autism and schizophrenia, like other things like that. And we'll work hand in hand with our other branches of our company, the Harris Center, to work on like cognitive behavior therapy or just counseling. I'm assuming you're talking about kids that are no longer in the situation, because that would be a whole nother story. So we would definitely try to link them and work with other therapies. So we actually had one recently who's a child whose father had passed a few years ago, and he was still hasn't worked through that. And so we tried to get them linked with other therapies and things as we're working on behaviors. Got one more question. This is not going to be a softball because this is my boss.
Oh, no, no, no. I just wanted to expound on your answer in terms of kids with autism that may have other issues that are going on. Normally what we do, we stay connected with other services that are within the Harris Center and also external services, so we'll know what resources that are available to us. When our program or my staff are doing their assessments, we readily know at the front in terms of what that child will need. When we see those things occurring, if there is a need for counseling for either the family or the child, that is one of the things that we do initially, so that the services that they are providing in conjunction with whatever counseling or additional resources are needed will be done simultaneously on the front end versus the back end. So therefore, we'll see a more successful rate of improvement. Okay.
Okay, that wasn't too hard. Thank you.
I believe that's all the time we have for questions. Thank you
Great,
so much,
thank you.
Kail.